My name is Kayla Albrecht, and I am a registered nurse at Children's Minnesota, where I work in the St. Paul Pediatric Intensive Care Unit, or PICU. I am testifying in favor of the addition of the mental health beds, but want committee members to know about the changes Children's is planning that will impact the care given to the kids who will use these mental health beds. There is a pediatric mental health crisis, and Children's is stepping up to ease the burden of this crisis. Children's is the perfect hospital system to do this because we are the kid experts. But there is more to the care of these children than just mental health inpatient services, and I believe their care will be compromised with Children's current restructuring plans. Children's is planning to remove the PICU from the St. Paul campus, where many kids' lives have been saved after drug overdose suicide attempts. The St. Paul campus will have an emergency department, which will serve as a starting point for the mental health program. However, before starting this program, kids need to be medically clear. Often the kids that are nearly successful in their attempts require intensive life-saving support, which can only be provided by a PICU and can include intubation or a breathing tube and hemodynamic support, like continuous blood pressure medications. I've been a part of these life-saving interventions and know how medically fragile these children can be. In our current model of care, these children are brought into the emergency department, quickly stabilized, and then are just an elevator ride away from the PICU with no delay in care. With Children's proposed restructuring plans, the kids requiring intensive care will be stabilized in the St. Paul Emergency Department, then transferred via ambulance to the Minneapolis PICU, which historically can take hours to occur. Once medically cleared, these kids will then be transferred to St. Paul, where they will begin the mental health program. This will create a tremendous burden on already stressed children and their families and is an unnecessary delay in care. Delays in care can have devastating consequences, as these children can rapidly deteriorate at any point, including in an ambulance where there are less resources. I chose to start my nursing career at Children's because of their values, one of which is kids first. A pillar of this value is to speak up when the care being provided is just good enough, not exceptional. An emergency department and a mental health program that are not supported by a PICU under the same roof is just good enough care, and I believe children and their families deserve exceptional care. I am in favor of adding these mental health beds, but they need to be supported by a PICU that is within the same building as the mental health beds. I urge the committee to consider requiring the PICU to stay in St. Paul before granting these mental health beds. Thank you for your time today.